Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Chris House. He's CTO at HealthAxis. Welcome, Chris.
Thanks, John. Thanks for having me.
Yeah, excited for this discussion today. It's really relevant, a mix of AI, automation, something that a lot of healthcare organizations are grappling with. So excited to dive into the topic. But before we do, tell us a little bit about yourself and HealthAxis.
Yeah, thanks, Sean. Like you said, Chris House, I'm the Chief Technology Officer here at HealthAxis. Been with HealthAxis now just over a year and a half. And for the last 10 years, have been working in the healthcare IT space, providing mainly software and service solutions for payers and providers.
Awesome. And tell us, AI is a hot topic, coming out of every conference. It's AI driven discussions for a lot of the things, but how is AI being used to optimize call center operations within healthcare administration? I'd love to hear, what you're working on there.
Yeah, for sure. So yeah, and you're right, John. AI is everywhere. It is literally in every aspect of our life in one form or another, at least in discussions, and at least in the excitement around what it can do for our work life as well as our personal life. Um, for healthcare, I think it is really, really important, and it's going to be more important as we move on. For us here at HealthAxis, we have started in a pretty obvious place, I think, with AI with regards to what it can do in our call centers. This concept of and what we see so much in our face today are these AI bots, whether it be Gemini, Chat GPT. These bots are out there that can provide information. They are in different forms. Obviously, you can type in a prompt in a web interface and get a text answer. The more advanced ones are chatbots that sound and act like human beings, and that's what we're in proof of concept with here at HealthAxis with the call center. Um, there's a lot of benefits for a chatbot and a AI enabled chatbot in a call center, and there's a lot of government and regulatory requirements around the quality of service within a healthcare call center. So we're using them to help triage calls and help do kind of the easy stuff, so to speak, within our call center. We are really looking at it as a staff augmentation. We
Hmm.
have quite a bit actually of seasonality with our particular, we're a Medicare Advantage, commercial and Medicaid service offerings, and we have certain times of the year where calls are just higher. Member enrollment is starting up now between now and the end of the year, so that's an area where we have higher call volume, and having the ability to scale with technology is a real asset for us. And instead of having to scale with just more human beings, we're able to do that with technology and quickly and frankly infinitely. Whereas with human beings, there's interview process, there's hiring process, there's training, there's attrition that we all have to deal with. That frankly we just don't have to deal with that in with technology.
Yeah, there's also degradation over time, I imagine, with a human is, especially in call centers. They're good at the beginning and then they kind of get bored. It's interesting. Talk to us more about some of those improvements of having AI-driven tools and what they've brought to the customer interaction. I know some of the key metrics: reduced average handle time, improved agent productivity. Talk to us about some of the results you've seen, using these AI-driven tools and any other examples. Obviously that's essential during that time when like you said, it spikes at the end of the year, right? Everyone knows that with Medicare Advantage. So I'd love to hear more about those key improvements from these AI driven tools.
Yeah, yeah. A couple of things there you mentioned. There's the qualitative piece and there's the quantitative piece. The quantitative piece is fascinating because things like average hold time, average speed to answer, abandon and drop call rates. Those are all metrics that we can measure and track. And frankly, we have regulatory requirements to meet certain standards there that hold us accountable for the quality of service that we're providing on behalf of our payer clients. And across the board, and any of those quantitative metrics, we see vast improvements. And just from the standpoint again of being able to scale things like average speed to answer. Well, when you've got a set amount of resources to pick up a phone and answer a call that's coming in, obviously the next call that's more than your set number of resources is going to be on hold, and that average speed to answer is going to go up for that member or provider. And so just having the ability to continue to pick those calls up, you immediately see that your ASAs are going to improve overnight, basically. The average hold times, another one, is just a metric where you're um, you're held by your capacity. And in our business, we're a small to medium sized business. We have to manage our capacity very tightly. We don't have infinite resources. And sometimes you've got the human aspect. Even the best planning at times goes against you when people have emergencies. People sometimes don't show up to work. The attrition topic we talked about earlier. So the AI chatbots and the human aspect of what AI brings now into a chatbot is a really big asset for us.
Interesting. Could you give some examples of it in action? Like, is it collecting the information from the caller so that then it makes the actual call go more efficiently, or is it answering some of their questions? So you're just getting the higher level question to the actual, people, or, what are some examples of this in action?
Right. So, these systems work very much like an IVR does today.
Okay.
An IVR, as everyone knows, is very rule based. It's the old school dial one for this, dial two for
Yeah.
that option style, and that's basically how these systems work. The nuance here is that the annoyance of having to listen to each of the five options and then maybe was it one or number two that I wanted? It is
Or you try
eliminated.
to, and then you're like, crap, I should have done three, and how do I go back? And
That's right. That's right. Exactly. And we today, some of these, and ours in particular, are phenomenal in their ability to mimic a human interaction. And that the purpose of that is not to trick the caller, but is to put the caller at ease and help them with deciding what the next steps are in getting their question answered in a way that is more engaging than would be a press two for this and a press three for this, which in and of itself does two things. It creates a better, more positive atmosphere for that caller, so we have a higher quality call, a better engaged caller, and then it makes it much more efficient. So just like when you're interacting with a person, you can tell the person immediately what you want instead of having to take the 8 to 10 to 15 seconds to go through those IVR messages. And so your total call time right there and then starts to go down from what we see today with traditional IVR.
That's amazing. I only laugh because we've all been there, right?
Yeah.
Like, we've all experienced it, whether it's healthcare or another industry. So that's interesting. Well, we talked a little bit about AI. I think the thing that AI is kind of set to the side, which is unfortunate, is RPA and robotic process automation. I'd love to hear about, how RPA is is helping to streamline the claims administration,
Yeah.
automating the repetitive rule-based tasks that happen with those processes. You know, and talk about what's the impact of implementing RPA solutions like this in healthcare.
Yeah. RPA for a company like ours, we are a CAP system. So we provide technology and services that help um, process healthcare interactions, claims, call center, member enrollment, provider data management. And all of these things are heavy, heavy data input services and technology. And there's just no way around it. The process to file a claim for a service that's been rendered from a provider to a member is intensely data driven. And in order to do that efficiently, RPA is just becomes part of the system. It really takes out the aspect of data entry, in some cases completely, but in a lot of cases just partially. And even in a partial situation where you've got most of the claim completed and you're completing just a portion of it, or there's a pending claim waiting information that you can automate down the road to move that claim from pending into the next adjudication process. When you do that thousands and thousands and thousands of times a day, those transactions add up to real time, real money. We all know time is money in this space. And again, when you can take a few seconds off of each claim for a human being that's in the workflow of adjudicating that claim, that time adds up for that worker.
Interesting. Could you share an example of that, of, you know, how RPA has transformed your claims processing workflows and, you know, and provided some of those efficiency gains that you talked about?
Yeah, a really practical one that really resonates with me is we still in the healthcare industry, as you know, and I know you probably have talked about this a lot. We're still operating on paper in a lot of places,
The fax
and
machine.
paper claims. We still get those paper enrollment forms. We still get a lot of those. So when we receive a paper claim or a paper member enrollment form, uh, the someone has to take that data that is often handwritten and translate that into the core administrative platform. Today, there's a lot of ways to do it, depending on the handwriting and how well that we can digitize that form. In some cases, it's literally someone typing it from the form into the system and using OCR, which is not a new technology in and of itself. But John, I got to tell you, AI and other tools have enabled it to be much, much more reliable. Just in the last 18 months, 2 years, we have seen a leap in OCR platforms and how good they are with the ability to take handwritten forms and digitize them. And that's one example of how we're using RPA to go from a digitally faxed member enrollment form to a newly enrolled member into our payer system.
Yeah, that's awesome. And you're right. OCR has, I mean, before, if it was typed perfectly, it was pretty good, right? Now it's amazing what it can do even with handwriting, which is pretty impressive, like you said. Talk to me more about how AI and RPA that we've talked about is kind of freeing up the time-consuming tasks that many of your staff have and allowing them to focus on the more complex cases and even to, you know, improve the service quality that at the end of the day the patients on the line, right, get to
Yeah.
experience.
Yeah. On the call center side, we talked a little bit earlier about the quantitative measurements and the qualitative. And the qualitative cannot be overlooked in what AI and AI-driven chatbots can help with. We're all human beings. We all have our good days and our bad days. Sometimes we're in a good mood, sometimes we're in a bad mood. And even for the professionals, right? Even for the call center staff, um, you know, being able to triage calls with a chat bot and take some of that load off of our call center staff has a impact. It has a very positive impact on their mental health and their well-being. They're able to take their breaks. They're able to feel like they can walk away from their terminal to have that break, and they won't have a quality ding against them because they did so. We have that flexibility with having being able to bring in those AI bots. So I think just again, a practical example of how that can improve the overall quality that we deliver and help our staff with the services that they provide back.
Hey, you're taking me back, Chris, from what my days working in a call center. I think the reason I was so successful at it is I was a robot, like I would just do the same thing every time. But some of the people just gave up, right? And,
Yeah.
and that's why I had a higher rate than my colleagues. And so it is interesting to hear that now, all these years later, and in ways that AI can help alleviate some of that stress for some of those people that do just give up because they're having a bad day or they had a
Yeah.
bad call experience or whatever it was. So, man, that was a bit of a flashback, Chris. But, you also mentioned that these tools are really about augmenting the humans, right? As opposed to kind of replacing them in many cases. Talk to me about your strategies for training staff on the use of this AI and RPA to make sure it goes seamless. It's seamless integration for them as staff and also the people on the other end.
Yeah. John, just like any new technology, you to do it successfully, you have to have a plan. And what we're finding here at HealthAxis is putting structure around these new technologies and how we roll them out, how we implement them has been really, really important. First and foremost, within our company, we have formed, somewhat of a center of excellence. And I think the larger the company, probably the more important that is. That center of excellence becomes your subject matter expertise for that technology, and they have the capability to talk to each of the functional areas and talk about ways that that technology is meaningful for that function. And I think that's really, really important. One of the things I think that are overwhelming about these major technology shifts that we see every 5 to 10 years. I think we're obviously in the middle of a really big one right now with automated artificial intelligence. Is what I can do with it. It sounds really cool. Everybody's talking about it, but I don't really know how it fits into my function. What is it going to do for me? And having that center of excellence and the people to support that function and discuss it is really important. Another one I think is having a real ROI, having that discussion about what we're doing and is there bang for the buck there. I've been in technology my entire career. There's always the tendency and the desire to do the next big cool thing, but we've all seen it over and over where the juice maybe isn't worth the squeeze at the end of the day. It was a cool technology for a cool technology's sake, not because at the end of it we had a real business impact. And at HealthAxis, again, we're that small to medium sized company, and so we have to be very purposeful about where we place our bets, so to speak. And we've got that structure in place where we scrutinize, these projects so that we can prioritize those items that we think are going to have the largest impact for our members and customers.
Yeah, as my friend said, healthcare needs to stop having shiny object syndrome.
Right.
It's
I'm part of
interesting.
that problem sometimes.
We all love a little shiny object, let's be fair.
Absolutely.
I mean, as you look forward, I think that brings up an interesting question. What are some of the practical advancements of AI and RPA that you foresee kind of further revolutionizing the healthcare operations in the next few years? I think we all agree we're at the start, right? Like it can do exciting stuff now, but what else do you see kind of going down the road as opportunities?
Yeah, for sure. So I'll talk first about my pain point, and it may resonate with some of the folks that will tune in to the discussion. For me, I'd love to see us get away from point solutions. Um, right now, again, these are early days. There's a lot of innovation happening, but they are point solutions for different parts of the tech stack in some areas or different parts of the service. I think that getting to a point where in your bigger enterprise offerings, your bigger enterprise tools in the technology space, having that AI integrated and in a mature state is going to be a boon for companies like ours, where we just can't afford to have 10 different vendors for 10 different solutions in our tech stack or our service offering. Um, Obviously, we're going to see RPA and AI come together. It already is in a lot of areas, but I think the deeper integration of those two are going to be really, really important, especially for healthcare. Going back to that, we're really a data-driven industry, and solutions like those that HealthAxis provide are about data management, about interoperability, and bringing together disparate sets of data. So having the ability for AI to be integrated directly into your RPA, I think is going to be a really important solution for companies like ours downstream. Um, in the bigger picture view, things that I'm excited about for AI in the healthcare space is fraud, waste, and abuse. We all know this is a really big problem for the U.S. healthcare system. We see it every week in a new article on how expensive it is to administer care in the U.S. I think AI is going to be really helpful and important in identifying fraud, waste, and abuse, helping us to um, change regulations in order faster in real time in order to prevent fraud, waste, and abuse. And that to me, I think is a real exciting future.
Yeah, that's awesome. Well, we started off talking about AI is everywhere, and I think it's great to hear from you, Chris, and how Health Access is kind of leading the use of AI, not just talking about AI and its potential. So it was great to hear some real use cases and the impact you're seeing in your call centers and on the claims processing, et cetera. So appreciate you taking time to share with us these insights and perspectives. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks, Chris.
Thanks, Sean.